creating a challenge to get people vaccinated. Tonight, we take a closer look at COVID-19 and the impact on communities of color. Good evening, I'm Valerie Pritchett. Over the next half hour, we'll explore why people of color are reluctant to get the vaccine and address the fear and myths that surround it. But first, let's take a look at how this virus is impacting communities of color. Since the pandemic began, COVID-19 has had a disproportionate impact on communities of color. More than 475,000 Americans have died. African Americans have died at 1.5 times the rate of Caucasians. And when it comes to the vaccine, a February survey by the Pew Research Center shows African American adults are the group least inclined to get vaccinated. Only 42% reported that they would get a vaccine. That's compared to 83% of Asians, 63% of Hispanics, and 61% of Caucasians. History and mistrust play a role, but so do chronic health issues, misinformation, and accessibility. And joining us now to address the concerns and to clear up that confusion, Dr. Stephen Henderson with Penn State Health Internal Medicine, Dr. Bolanle Liman, Chief Medical Officer with Hamilton Health Center, Dr. Cherie Livingston, the OBGYN Chair at UPMC Lidditz, Dr. Cherise Hamblin, OBGYN with Penn Medicine Lancaster General Health. I want to thank you and your health systems for coming together tonight for this important conversation, doctors. And let's start off with those questions. What are communities of color, and especially African Americans, why are they not getting vaccinated? Dr. Henderson.
Thank you, Valerie. Yes. It's a complex question and complex answer. As you stated clearly, in the Kaiser Family Foundation, they found 35% of African Americans will not get the vaccine. So why is that the case? And what can we do to change the narrative? Well, we want to address that is vaccine hesitancy and also vaccine equity. So vaccine hesitancy, as you mentioned clearly, there's a lot of historical distrust that the African American community have from past history of the Tuskegee study that's been unfortunate stained the Black community from 1932 to 1972 that we have to address and acknowledge. And also the Henrietta Lacks case, that's also the Black community reference. And I'll defer to my OBGYN colleagues to talk a little more detail about that. But there's a lot of misinformation out there. So some of my patients believe that the vaccine has a microchip in it, which it does not, that the vaccine can give you the coronavirus, it cannot, that the vaccine can change your DNA, it does not enter your cell. So we first need to understand the concerns, realize the historical facts, but also let's see, why is that the case that they're not getting the vaccine? Is it vaccine equity and awareness? So we must make, okay.
Thank you, sir. And we mentioned a moment ago that COVID-19 can be more deadly in people of color. Dr. Liman, talk a little bit about that.
I think that's in large part for two reasons. One is the comorbidities. So unfortunately, people with comorbidities are at higher risk for complications and then subsequently death. And that is one of the reasons that the phase 1A was expanded over a month ago to include patients with multiple comorbidities. So I think that that's the main reason.
And also, let's talk specifically about the fear. We touched on that with the medical system itself. There's a history we heard with the Tuskegee Airmen and the syphilis study that they did, chemical experiments in the 60s, general mistrust. Dr. Hamblin, talk a little bit about that.
Well, I'm an OBGYN, and so I've taken care of women. I talk about trust all the time. And I like to use relationships as a point of comparison. Trust is built over time in any relationship. And if you have experiences where you feel a partner is not trustworthy, you will have suspicion. And I think that there's historical information and historical things, but then there's also the current state. And so if there are current things that make it difficult or that continue to engender that mistrust. And so I think the medical community, this pandemic is a perfect opportunity to build trust through positive interactions, through a different experience than what has been in the past for communities of color.
Yes.
And what I mean by that is to say that if we recognize that there has been a disproportionate impact in a negative way for communities of color, then our response and our care of communities of color should be showing a redoubling of our efforts
Thank you,
to reach
Doctor.
communities of color with vaccine, with testing, and with mitigation strategies.
Thank you, Doctor. And just super quickly, Dr. Livingston, when it comes to these vaccines, access is an issue sometimes.
Access is an issue, and all of our facilities are working extremely hard to distribute the vaccine appropriately. There are many programs. UPMC has a UPMC 10% program where we look to get vaccine out to federally qualified health centers. But more importantly, the goal is to get the vaccine out to communities significantly impacted by coronavirus, like the communities of color.
Yeah, we'll talk a little bit more about that. Thank you very much. We have much more to talk about. Up next, we clear up some of the myths and concerns when it comes to the vaccine itself. And later in the show, we'll answer your questions about the virus and the vaccine. Stay with us. And welcome back to our conversation on COVID-19 and communities of color. As we talk about the vaccine, we also want to talk about the misinformation that is out there, including a lot of conspiracy theories going around. Dr. Limon, what are you hearing about this now?
I think there are multiple things. So I think part of the concern is the speed of the clinical trials. And I think that there are many things that we can learn from that. So it was a randomized, large, both of them from Moderna and Pfizer, controlled clinical trials. I think another concern is, false material in them, which is incorrect. And Dr. Henderson mentioned a few of the others.
Yes, and Dr. Henderson, let's get the facts. What is this vaccine? It used to be in the day, they would put a little piece of whatever the virus was and your body would build immunity. But this is a whole different system now.
Yes, correct. This vaccine is called the messenger RNA. It's been out since the 1990s and it's been tested previously in HIV and Zika virus. So this is a genetic code that's injected into your muscle cells. It instructs your cells to produce the spike protein. So it doesn't go into the nucleus of the cell, so it doesn't change your DNA. So once it produced the spike protein, the body developed antibodies to the spike protein, and that's how it protects, and that's how you develop your immunity. So it doesn't change your DNA, it's not a live virus, and it's a safe vaccine.
And how many of you were able to get the vaccine? Show of hands so far. As doctors, you should all have it. Okay, so Dr. Livingston, tell me a little bit about the side effects. Did you experience any?
So I received a full course. Obviously, Pfizer, you received your first dose, and then 21 days later, and 28 days for Moderna. And I did not receive any side effects. I had a sore arm, but it's important to tell the population that about 11% of people will experience things like fever. That's very normal. Actually, the more side effects you have, and most people will have more side effects after the second dose because your immune system is familiar, it's recognized it. But many people will have what we call a boost, and that's a good thing. That's indicating that your body is responding to the vaccine and you're producing a good amount of antibodies.
So you do want to feel a little icky afterward. That's a good thing.
Exactly.
So Dr. Hamlin, the vaccines we now have require 2 shots. Explain the importance of making sure you get that second vaccine.
So as Dr. has already been stated that, the first dose, you're getting, you're initially being able to recognize that spike protein. The second dose is when you're really mounting a larger immune response. And so for like any other medication, you want to have the complete course. We do know that there's significant immunity that happens after the first dose, but you will get up to 95% immunity or 95% decreased chance of being hospitalized or severely ill from COVID if you were to contract it after getting both doses of the 2 available vaccines.
And that's a pretty good effective rate. I think the flu actually has less, the flu vaccine, so you're getting a pretty good boost for your immune system when you're getting the vaccines. And what about these variants, Dr. Henderson, we're hearing? Anything latest and newest talking about these current vaccines covering those variants?
Yes, as of now, the coronavirus vaccine, the Moderna and Pfizer, both are fairly protective against the variants. But that is the concern, is that the more that patients become infected, the more viruses will replicate. So the longer that we wait to get the vaccine, the more chance of these variants to develop, because more virus will replicate. As of now, the vaccines that we do have are protective against the variants.
I know there's always been a question about if you have COVID, you already had it, should you still get the vaccine? Which doctor would like to address that?
It's Dr. Livingston. I'll address that. So the CDC recommends that you wait 90 days after you have been infected to receive the vaccine, just to give your immune system time to rest.
And another question, we have 2 OBGYNs with us. If you are pregnant and you have COVID and you have the possibility of getting COVID-19 vaccine, what is the recommendation currently? Let's go with Dr. Hamblin.
Yeah, so the current recommendation is that pregnant women should not be excluded, meaning pregnant women should be able to get vaccine if they want to. Anytime there's a shared decision-making model. And so part of this decision-making is with your doctor of what's your risk of getting COVID versus your concerns about the vaccine. Pregnant women were not included in the trials. However, many of the women who were involved in the study became pregnant during the course of the study. So we have seen no untoward effects of the COVID vaccination for pregnant women.
And Dr. Livingston, even more important for African American women who have a high maternal and infant mortality rates.
Black women are 4 times more likely to die inside of pregnancy. And so we being the American College of OBGYNs and the board certified physicians here, strongly recommend that women get the coronavirus vaccine, primarily because if you are pregnant and you get COVID, you're more likely to experience severe illness. If you are pregnant and you get COVID and you end up in the hospital, you're more likely to end up in the ICU, the intensive care unit. And unfortunately, if you're pregnant with COVID and you're in the ICU, in the intensive care unit, you're actually more likely to end up on a respirator. So there's strong recommendation to prevent illness, mitigate factors, and get the vaccine.
And quickly, Dr. Liebman, we only have a little bit of time, but for younger people, like 20s, 30s, to get the vaccine, the importance of that.
Very important, and that's one of the reasons, like I mentioned, that those eligible for phase 1A have expanded. So it now includes BMIs above 30, smokers, and importantly, it's not just because you're protecting yourself, but because you're protecting those around you.
Okay, thank you. We'll be right back with more information. And welcome back to this conversation about COVID-19 and communities of color. The vaccine rollout is underway. It's slow going, and it could be some months before most of the U.S. gets inoculated. So, Dr. Limon, share a little bit more about the importance of people getting tested if they feel sick.
So the importance of getting tested remains the same as it was before. You want to get tested so that you can appropriately isolate yourself if you are infected and not infect others.
And then, Dr. Henderson, the tests are much more widely available now, but there's still some barriers when it comes to Black and brown communities getting them.
Yes, it depends on the access for testing. There's been some studies say if you live 20 minutes from a testing facility, worse outcomes. So transportation is an access, and also to know where to get the test. So you have to inform the communities of color where to get the test, but it is a barrier.
And let's talk about masks. The CDC recently saying doubling masks because we have these new variants offers more protection. Dr. Hamlin, your thoughts?
So a double mask is fine. The main thing is the message is the same all around. being without a mask in front of or with people that are outside of your family. The only reason I'm here with no mask on is because I'm in a room by myself where I've locked the door. And I think that it's important to frequent hand washing, soap and water or hand sanitizer, and really limiting your exposure as best you can. And so for some people that means they're working from home. For others, it is that they are, staying home as often as possible and not socializing or congregating with people who are outside of those that live in their house.
And Dr. Livingston, the best type of mask to wear and the proper way to wear it. A lot of times we see people with it below their nose, sometimes below their chin, sometimes not really tight. Let's talk a little bit about that etiquette.
Yeah, so it is extremely important to ensure that your nose and mouth are covered with the N95, which is the best mask, and we wear that when we're standing face forward with a COVID patient. You have to get fitted for that, because if there's air leakage on the side, it's ineffective.
Yeah, and we're still going to be wearing masks long after people get the vaccine, correct, Dr. Henderson?
Yes, correct. Because there's still a chance, even when you receive the vaccine, that you can still contract the virus and you can still transmit it. So you still have to wear your mask after vaccination.
And a lot of hand sanitizing going on lately and a lot of hand washing. The preferred is hand washing there, right, Dr. Limon?
Correct.
Okay. Well, thank you very much. We have more to talk about later. We'll be right back. And welcome back to COVID-19 and Communities of Color. We want to get to some questions directly from our viewers, and we are going to start with Terry from Adams County, who asks, why can't people over 65 with COPD and diabetes get a COVID-19 shot? Pennsylvanians over 65, though, are in Group 1A, so are people with serious health conditions, but a lot of people are having a tough time getting scheduled. Any advice for that scheduling? And we'll start with Dr. Limon.
So I'll share the good news. So the DOH just came up with new recommendations for large health facilities, or I should say systems, and pharmacies as of this week. So rather than addressing the problems behind us, I think the audience will be glad to know that as of this Friday, they will be required to offer the vaccine. I think just basically one of the complications that people should know is that we have not had a vaccine like this for adults in decades, where there are 2 doses that are required, where sub-freezing temperatures required to store them, whether you have to get the second dose within a small and narrow time frame. So those were some of the limitations, but hopefully those will be addressed within the next few weeks.
Oh, that's good. Carol from Dauphin County asks, why are the vaccines being offered to people of color through Black and brown organizations within their communities? Dr. Henderson, I think they want to see more outreach.
Yes, and I agree. We do know that in the communities of color, disproportionately affected, as you stated in the very beginning. We often have high blood pressure, diabetes, obesity, and chronic kidney disease. Those 4 conditions are more prevalent in our communities of color. And with COVID-19, when you have those conditions, more chance of dying. So we need to reach out to the communities that are affected the most. We need to go to the community because they may have lack of transportation, lack of access. So mobile vans, we're being talked about at Penn State Hershey. So Penn State Hershey has developed a mass vaccination site at 5 different areas as of starting the next 2 weeks. So I think most health systems are reaching out to the communities.
Okay, we're getting down to one of our final questions. Another viewer asking, do you think the COVID vaccine will fall under the annual vaccine category like the flu? Dr. Livingston.
I think that it will. I mean, we know that the vaccine efficacy, based on what we currently know, is about 90 days. So we don't know if the immunity wears off. And just like the flu vaccine, where you have to receive an injection annually, we suspect that the COVID vaccine will likely be necessary every 1 to 2 years.
Dr. Hamlin, one last question. Andrea from Dauphin County is worried about her mom. She's 80, underlying conditions, high blood pressure and diabetes among them. She should be concerned about the side effects from the vaccine.
The most important thing is to think about you're weighing risk versus benefits. And so here you're weighing the risk of your mom getting COVID versus the risk of side effects. And so if your mom has been trapped in the house for the last year for fear of getting COVID, rightfully so, the vaccine is the way out.
And so there we have it. Hopefully that vaccine distribution will get a little bit better as we go on through this pandemic. I know Pennsylvania was having a tough time getting its allotted amount, so hopefully we can see it soon. I want to thank all of you for joining us tonight, all of these doctors who spent their time and their facilities who were kind enough to let us borrow them, and hopefully we get the information out that people need to know and that you, a viewer, will consider getting the COVID-19 vaccine. Thanks for answering all the important questions for the viewers, and thanks for watching. Have a good night.